This video demonstrates the Brunelli flap, also called as the dorsocubital or the dorso-ulnar flap. This patient presented to us with dry gangrene around 3 to 4 weeks after the trauma, and post debridement we had a volar oblique defect of the thumb which was distal to the IP joint. So Brunelli flap was planned. These are the markings. We have a mid dorsal line and we have a ulnar mid lateral line. Between these two lines is the dorso-ulnar artery, lies the dorso-ulnar artery, and that is the axis of the flap. So you can appreciate the IP joint crease. 4 to 5 millimeters proximal to the IP joint crease lies the pivot point of this flap, and then follows the tail, and D is the part of the flap which would eventually go into the defect. Now we start harvesting the flap by circumferentially islanding it. Now this flap is perfused by the dorso-ulnar artery, specifically a retrograde flow through the dorso-ulnar artery. Now the princeps pollicis artery connects to the dorso-ulnar artery at the IP joint level. So that is why we have our pivot point which is 4 to 5. You can appreciate the bright red beading. This is around 4 to 6 weeks